Hi, I'm Jennifer Hinke, the laboratory manager here at the Coachella Valley Mosquito and Vector Control District. This video is about the district's invasive mosquito management program and our Arbovirus response plan. Aedes aegypti and Aedes albopictus can transmit dengue virus. These mosquitoes pick up the virus from infected people, and after some time, they can transmit the virus to a new person when they bite. Zika, chikungunya, and yellow fever viruses have very similar cycles. At this time, we have not had any transmission of dengue or Zika in the Coachella Valley. But because Aedes aegypti mosquitoes are here, it is possible that we could have transmission in the future. The district conducts our work using an integrated vector management program. This means that we use a science-based approach to control mosquitoes and other vectors. We conduct surveillance to determine when and where the mosquitoes and the viruses are present. We educate residents and property owners on how to reduce mosquitoes where they live, work, and play. And when the conditions are right that the control is needed, we use physical control to remove standing water where mosquito larvae can live, as well as chemical control, that is, using the appropriate control products targeting mosquitoes where they live and are active. The district reviews the California guidance for surveillance and response to invasive Aedes mosquitoes and dengue, chikungunya, and Zika in California, which is produced by the California Department of Public Health. Our invasive mosquito management program and Arbovirus response plan adapts this information to be specific to the needs of the Coachella Valley. Our plan outlines how we carry out the surveillance of mosquitoes and the viruses they can transmit, what control options are available to us and what we use, how we communicate the risk, and how we coordinate our work with other agencies involved. When someone is sick with dengue, their medical provider informs the Riverside County Public Health Department. Riverside Public Health then shares with us where that person lives, as well as other information that will help us reduce the risk of transmission of dengue to other people. In response to this, the Surveillance and Quality Control Department will set extra traps in the area to find out the abundance or the number of mosquitoes in that area and to send those samples of mosquitoes for testing. We will check the efficacy of products that we use to control mosquitoes so that operations can use the most effective products. In operations, our vector control technicians will use our internal system to see the known mosquito habitats that need to be checked. They will also post disease warning signs at intersections and entrances to communities. They'll conduct inspections in the area, requesting to get into people's yards to look for mosquitoes. And they also look for areas of non-flowering plants where an application can be made to target mosquitoes that rest on those plants. Our public outreach department increases their communication to the community, targeting the same areas that we are all working in. They spend their time reaching out to and educating leaders and residents in those neighborhoods. Once we have additional information on the abundance or the number of mosquitoes from our traps and from our inspections, we will make additional responses. Typically, these are in the form of adult and larval mosquito control activities. Applications of adult mosquito control products are made in the evening or in the morning before sunrise, while applications for larval mosquitoes may be made at any time of day. We make these using truck and helicopter depending on how much virus activity and how much mosquito activity is in the area. We also reach out to city, county, and community leaders directly to spread the word on how to help us reduce the mosquito population and how to prevent people from being bitten by mosquitoes. Public outreach shares this information by press releases, and this will result in TV, radio, and newspaper stories. As we complete this work, behind the scenes, the district managers are also having discussions with county, state, and other mosquito control districts to coordinate our efforts. We have ongoing discussions with our vendors to ensure that the supplies that we need will be replenished. We partner with the county to ensure that our medical community, that is our doctors, nurses, nurse practitioners, and others, recognize the symptoms of these viruses so that patients can be tested quickly. It is important to know that everyone has a role to play in reducing virus transmission in the Coachella Valley. It is important that we all communicate with our representatives and our elected officials on the importance of public health funding This includes making sure that there is support for the CDC, the California Department of Public Health, and the Riverside County Department of Public Health. We all have a responsibility to be proactive in protecting ourselves from mosquito and insect bites, and this means wearing insect repellent both here at home and when we travel to ensure that we're not bringing a virus back with us. We also have a responsibility to share the information that we know with our friends and our neighbors so that they are also protected. Thank you for viewing this video. If you have questions or if you need service for mosquitoes or vectors, please reach out to us by phone or by email. Thank you.